everyone. Dr. Andrew Rothschild, physical therapist with the Virginia Center for Spine and Sports Therapy. Hope everyone's week is off to a good start. So what I want to talk about today is, again, coming back with this concept of pain. Again, because people, general public and healthcare professionals alike, do have a very poor understanding of pain and what it is and what it means and what creates it. And to be honest, the experts in the field are still trying to figure out a lot of it as well, because how the brain works is extremely complicated and complex. But what we think we know now is that pain is not an input from the tissues. There are no pain receptors in your body. There are no pain messages. You don't have any nerves that detect pain. Tissues don't create pain. Pain is an output by the brain meant as a protective response. It's an evolutionary design to protect the species, essentially, from harm, from injury. The brain's goal is protection. But what that doesn't mean, and what gets misconstrued a lot, is that it does not mean that pain is in your head, because that has the implication that you are making it up or that you are crazy, and that is not the case at all. What it does mean is that pain is a very complicated output based on multiple factors, tissue health and tissue sensitivity being one of them, regarding the perception of a threat to the organism, which is yourself. And that can be a physical injury. It can also be related to stress, fear, anxiety, thoughts, beliefs, what you've been told. So there's a lot of factors that go into that. Memory especially is being one of them. And they've done a lot of research looking at pain and fear and its association with memory, and very often pain, a lot of times, what part of your brain does is tries to figure out, when did this happen before, where did this happen, and what was the result. So for example, if you had a back injury while lifting up a heavy box and it caused an actual tissue injury, and there was a healing period of time, and there was a period of time where you couldn't do the things you enjoyed, and it caused you a lot of stress and anxiety, that experience sort of gets imprinted on the brain in what we call a neurotag. It's sort of a neural signature. It's a pattern of nerve firings and nerve cell, brain cell firings that form a unique pattern to that specific experience. But that same neurotag can get evoked by just bending over and picking up another box years later, and you could experience the same kind of pain when in fact this time there is no tissue injury. But because you felt a little bit of an the brain gets an incoming message about some stress to some tissues in the same area, it all of a sudden recalls that same event, that same situation, all the stress and anxiety and things that went along with that experience, and it goes into overprotect mode, and it produces all this pain to get you to take action, to get you to pay attention. But in this situation, it's more of a perception or illusion. It's not what is actually happening. It's not necessarily associated with tissue injury. And the nice thing about it, from a clinical perspective, is very often things that have what we call a mechanical presentation, meaning that there is a specific tissue injury presentation, follow, for the most part, a pretty specific pattern of behaviors in terms of things that aggravate them, things that make them feel better, things that provoke them, certain time periods which they will recover from. And when they kind of fall outside those parameters, when the symptoms are less specific, they're more diffuse, they're more variable, that really helps us identify that this may be more of a, not necessarily a reflection on the state of the tissues of a tissue injury, but more a state of protection, more of a state of nervous system sensitivity, as I like to call it. And an example I'll often use with patients is sunburn, because most of us have been sunburned at one time or another. And if you can imagine that one arm gets sunburned and one arm doesn't, if I kind of give you a smack on the arms together with equal pressure, you will feel it a lot more on the arm that has been sunburned. But when you look at the arm, there was no damage. I did the same amount of pressure on the other side. There's no tissue damage. It just gives you a lot more significant feeling because of the sensitivity. So if you can imagine that happening in the nervous system, in the spinal cord, in the nerves, in the brain, that just hyper excitability, that hyper alertness, so it kind of gives you a warning very quickly, but does not necessarily indicate the issue that is maybe going on. And if you've been having pain for most situations for more than 6 months or a year, it's likely not driven primarily by the tissues, because most tissues will heal in that amount of time. You know, you can break a femur, biggest bone in the body, the one that takes the longest to heal, and that will heal before 6 months. So most tissues will heal in that time frame. Now we know nerves sometimes take a little bit longer, sometimes discs take a little bit longer, but that's about the time frame where most things should heal. So beyond that, it may be more that the pain is no longer a symptom, but pain is the problem. But the nice thing about that is that physical therapists are well positioned and well trained to identify and handle this situation, because this is a situation that is not resolved by medication, and it was not resolved by injections, it is not resolved by surgery. Physical therapy is probably the best thing for you. All right, that's my soapbox for today. Hope everybody has a wonderful day, and I will look forward to talking to you tomorrow. Bye.